We're going to turn now to the growing debate over whether all of us should now be wearing masks. Since this crisis began, U.S. health officials have repeatedly said that healthy people should not wear masks unless they're caring for someone who's sick. But some experts are now saying that wearing masks may be a beneficial way to stop the spread. Steve Osensami is outside the CDC in Atlanta with more. Good morning, Steve.
Good morning to you, George. There is disagreement about whether wearing an ordinary average face mask protects the average person from the coronavirus. This here is an N95. This is high demand and short supply because health professionals need this to protect themselves while treating patients. Here at the CDC, they argue that having the average person wear an ordinary mask can be counterproductive because you're often putting the mask on and off your face and spreading disease. But there are a number of scientists who disagree.
Sanjay, is there any way to capture how worried people should be today on a scale of 1 to 10?
Extremely serious. Starts with a slight fever, dryness of the throat. As the virus penetrates red blood cells, the victim becomes dizzy. Begins to experience an itching, a rash. From there, the poison goes to work on the central nervous system, causing severe muscle spasms, followed by the inevitable drooling. At this point, the entire digestive system collapses, accompanied by uncontrollable flatulence, until finally the poor bastard is reduced to a quivering, wasted piece of jelly.
Sanjay, thank you very much every day for updating us on this. And again, at 6 p.m. Eastern this evening, we will hear.
Well, fresh hope in the fight against COVID-19 this morning, with Australian scientists launching the first testing on potential coronavirus vaccines.
Sounds good, doesn't it? In what's being described as a critical milestone, the trials are expected to take around 3 months at CSIRO's facility in Geelong. And Dr. Rob Grenfell is the CSIRO Health Director and joins us now from Melbourne. Doctor, good morning to you. Thank you so much for your time. I was so looking forward to talking to you. What will these tests involve?
So these tests will actually involve the candidates that we have received from the CEPI, which is the Coalition for Epidemic Preparedness and Innovation, and approved by the WHO for testing. We'll be testing these on our models. We actually have a ferret model that we've been working on since January to analyse the effectiveness of vaccines. Over that period of time, we immunise, then we actually expose to the virus, and then we work out how effective those vaccine candidates have been at working, so they then can move on to human trials if they work.
What do you mean you immunise? Just talk us through that process. You immunise with what first?
So we have been presented with 2 samples that the WHO and CEPI selected as first entrants into this test phase. So we immunise our test animals, and we immunise them with these 2 samples, and then after about a 3-week period, we then expose them to the virus, and we look at how those vaccines work and what happens.